I would like to introduce to you Dr. Asha Dalal, who is the Director of Obstetrics and Gynecology at the Sir H.N. Riliance Foundation Hospital. She is an expert in the field of menopause and will guide you through many issues related with menopause.
With life expectancy rising, today we have more and more women in their 50s and above who are very active, and they definitely do not want their life to pause. I am sure all of us have met women, friends, relatives, neighbors, the common complaints and the common symptoms. I'm 41 years old. I have not got a period for 1 year. Do I have an early menopause? I'm getting a period every 3 monthly, 4 monthly. What should I do? You know, I get a lot of hot flashes, night sweats. I do not get sleep. The family will tell you she's impossible. She has got so many mood swings and she has now started forgetting things. A little later, there will be others who will be telling you, I have urinary symptoms. I don't know why. I have urgency, I have frequency, and when I'm doing my exercises, a little bit of urine, I pass. Friends, these are some of the symptoms which are occurring during menopause. Now, technically, menopause is when you have not had a period for 1 year, but this doesn't happen suddenly. There is a period of time varying between 1, 2, 3 to 10 years, which occurs before the menopause, where you get the symptoms, but the period is still on. One more thing I would like to tell people, many people come and say, 3 years ago I was menopausal, now my menopause is over. There is no menopause over. What symptoms you may get, what I was discussing about, these are the symptoms of early menopause. Then the symptoms of intermediate menopause or intermediate menopausal symptoms, which is 10 years down the line, they are mainly the urinary symptoms. And lastly, later, after the 60s, you have the late symptoms of menopause, which include osteoporosis and coronary vascular disease. We hope to be offering comprehensive solutions to all your problems. So let us start with the first. You are now 40 plus. What should you be doing? Every woman who is above 40 needs to get some screening tests done. Now these tests include a pap smear for ruling out a cervical cancer, a pelvic sonography which looks at your uterus, tubes and ovaries, and a mammography. Now, why are we doing these tests? These tests are done basically to rule out a malignancy, but otherwise also if you are a candidate for HRT, HRT is not a bad word. You need to make sure that all these things are in place. When I'm talking about HRT, we are talking about replacing the natural body hormones with synthetic ones. This may be in the form of tablets. You may also be given what is called the plant estrogens or the phytoestrogens. There are other things also which are given. Now HRT, you start it early, give least amount of dose for the least amount of time. Next you come to abnormal bleeds. This is also diagnosed with a sonography. Most of the times they just are polyps, but definitely you need to see that there is no cancer. The other testing that we do over here includes osteoporosis, that is the bone densitometry testing. In case you are detected to have osteopenia, osteoporosis, of course you will be treated. Treatment is just not medication. It includes diet, exercise, as well as giving appropriate therapy that you require. Now you come to urinary symptoms. We offer a full range of urogynec solutions. Your problem may just be urgency, frequency. It can be a stress incontinence, it can be a uterovaginal prolapse, You may feel something is coming out. Irrespective of what your problem is, there is a treatment for everything. You know, your problem may be something as simple as vaginal dryness. This is also manageable. Whether it is dryness, whether it is an incontinence, the solutions will include and vary from local application medications to tablets. You can also be having to be given high frequency lasers, Botox, whatever is your problem, we offer you a solution depending on what you need. Sometimes it can also be that some issues are not always treatable, but we can at least help to make everything much better. A full urogynecological setup is there to help you to deal with all these issues. Next, we come to the management of, one of the very common problems, forgetfulness, a little bit of not able to multitask. Whatever the issue may be, we look into it and we are going to offer you. We are not saying that we are a menopausal clinic. This is not for you to come when you have a problem. We are offering you a solution before a problem occurs. You come to us healthy, we would like you to remain healthy. This is not just a menopause clinic. We are a well woman center and we would definitely like you to make use of all our facilities. Thank you.